Sickle cell anemia is one of the most highly prevalent monogenic disorders in the world. It affects an estimated total of 100,000 people in the U.S., including 40,000 children. Notably, in 1949 it was the first inherited disease to be identified at a molecular level by Linus Pauling and colleagues. It was also the first genetic disorder to receive targeted federal funding for research in 1972. The condition arises from just a single point mutation that disrupts the proper translation of the beta-globin subunit of hemoglobin. Sickle cell can produce a number of adverse life-threatening conditions, including avascular necrosis, which is caused by blood supply loss to the bones, as well as a chronic lung disease and renal failure, among many other complications. These complications lead to an average lifespan shortened from 76 to 54. Additionally, patients report disruptive pain 1 in every 14 days, causing interruptions in an individual's ability to work, attend school, and participate in social activities. There is a noticeably disproportionate overrepresentation of the condition among people of African descent. One study found that where 73 of 1,000 newborns of African descent will possess at least one copy of the mutated allele, only 3 of every 1,000 white newborns will have the trait. The phenomenon raises the question, what might have caused this gene to increase in frequency in ancestral populations? If the consequences of having 2 copies can be so deadly, the answer is heterozygous advantage. The beta-globin gene expresses incomplete dominance, which means that the heterozygous individuals will express a phenotype in between the normal and disease state. The resulting blood cell is distorted slightly, which has been found to prevent infection by malaria without producing symptoms of anemia. So, while the trait could have some benefits to a population as a whole, the costs inflicted on those with the disease are immeasurable.
Known pathophysiology of sickle cell anemia. Hemoglobin is essential for transporting oxygen and nutrients in the blood to bodily tissues that require it for all types of functions. There are many types, such as hemoglobin A and hemoglobin A2, but the abnormal form associated with sickle cell anemia is hemoglobin S. Other abnormal forms of hemoglobin include HbC, HbF, normal in fetuses and newborns, but high levels are problematic in adults, and HbE, a common variant in Asian populations that seems to cause clinical problems when interacting with other blood disorders. Sickle cell anemia causes many issues due to its curvature shape. The change in shape causes the red blood cell to become less flexible and more rigid, thus making simple functions of the cell more complicated to perform. The main problem of the curvature shape is that it makes it easier for these cells to clump together and eventually impair blood flow, which can lead to a number of problems for the patient. The term anemia is used because sickle cells tend to usually die within 10 to 20 days, which is a lot shorter than a typical red blood cell's lifespan, about 4 months. Thus, the lack of red blood cells causes oxygen shortage and therefore more fatigue. Anemia is one of the more common and severe forms of sickle cell disease. It is an autosomal recessive disorder, which means children must inherit 2 copies of the mutated gene from numbered chromosomes, one from each parent.
Sickle cell anemia is caused by a mutation in the B-globin gene allele on chromosome 11p15.5, where GAG is turned into GTG and therefore results in glutamic acid being replaced with valine. Hydrophobic motifs on T-state HbS tetramers are exposed, leading to BS globin change binding and HbS polymer formation, whose growth can distort red blood cell membranes, leading to complications like sickling and hemolysis. A main symptom of sickle cell anemia is episode of pain, called pain crises, which happen when sickle-shaped red blood cells stop or hinder the flow of blood to the chest, abdomen, and joints. This blockage of blood also causes swelling in the hands and feet. Another main issue caused by sickle cell anemia is that of frequent infections. This causes much damage to the spleen, which is highly important for protecting against infections. Children with sickle cell anemia have to frequently receive vaccinations and antibiotics.
Sickle cell anemia can affect how organisms function in many different ways. For example, blood flow and circulation. Blockages in blood vessels can cause them to clump together and block blood flow in small blood vessels. Ischemia is referred to as reduced blood flow, and as a result, these blockages cause severe pain known as vaso-occlusive crises. When left untreated, prolonged ischemia damages major organs such as the brain, heart, liver, kidneys, and spleen. Oxygen transport and delivery is another way it can affect the organism functioning of sickle cell anemia. Abnormal hemoglobin, which is the hemoglobin in sickle cell anemia, causes red blood cells to become rigid and shaped like a crescent under low oxygen conditions. Sickled cells have a diminishing ability to transport oxygen effectively because of tissues leading to chronic weakness and fatigue, which is also referred to as reduced oxygen carrying capacity. Endothelial dysfunction is a significant feature of sickle cell disease. The aggregation of mutated hemoglobin molecules can lead to cell lysis, releasing free hemoglobin and NADPH oxidase into the bloodstream. This process generates free radicals and other harmful byproducts, triggering inflammation in the surrounding tissues. Damage to the endothelial cells can lead to tissue edema and also exacerbate inflammatory responses. Another way it can affect how organisms function is immune system impairment, specifically splenic dysfunction. It is often damaged or not functioning in sickle cell patients, and this can make the patient more prone to infections later on. For example, sickle cell patients are more susceptible to bacterial infections such as pneumonia and meningitis. Lastly, sickle cell disease often significantly affects quality of life. Patients experience frequent hospitalizations, daily activity limitations, and this can also negatively impact physical and mental health, as well as social interactions, employment, and your overall well-being.
There is no widely accessible cure for sickle cell disease, but there are treatments that can help patients manage their symptoms and complications. Current treatments often focus on managing individual symptoms rather than addressing the underlying pathology of sickle cell disease. So emerging treatments such as gene therapy are focusing on overcoming these limitations. Here I'll cover some of the current and emerging treatment options as well as their limitations. Bone marrow or stem cell transplant is the only known cure for sickle cell disease. However, it's limited because it requires a suitable donor, and the procedure is also very intensive and carries unpredictable risk. One well-established treatment is hydroxyurea. This medication works by increasing fetal hemoglobin levels, which reduces the number of sickle cell-shaped red blood cells and decreases pain episodes. This medication requires careful monitoring. However, hydroxyurea has its challenges, which include inconsistent access to treatment across different regions and populations. It also may cause side effects. Long-term effects also remain uncertain, and it's also not suitable for all patients. Another common treatment is blood transfusions. They can help prevent complications by increasing the number of healthy red blood cells. The downside, frequent transfusions can lead to iron overload, and there is always a risk of transfusion-related complications. A promising option being studied is metformin, a drug commonly used to treat type 2 diabetes. Research suggests it suppresses inflammation, induces fetal hemoglobin synthesis, and reduces the risk of ischemic injury in sickle cell anemia. The limitations include it's not widely prescribed for sickle cell anemia yet. Most of the benefits are still experimental with clinical trials underway. Plus, metformin may cause side effects such as gastrointestinal discomfort, low blood sugar, and potential liver problems. Emerging gene therapies are revolutionizing sickle cell disease treatment. These therapies alter gene expression to increase fetal hemoglobin, reducing complications such as vaso-occlusive crises. As it is still in development, there are many limitations which include long-term risks that are still unknown. They may not fully prevent complications like organ damage. The medications used for gene therapy can also cause serious side effects, and overall these treatments can be very costly. While there are many different treatments available, many patients, particularly in underserved areas, lack access to specialized sickle cell care. This hinders proper diagnosis and management.